So, how do you even begin to rebuild a country's entire healthcare system, especially when it's in the middle of a crisis? Well, today we're diving into this incredible blueprint from Syria that plans to do exactly that. It's a plan to completely reinvent how they train their doctors, their nurses, and their pharmacists for a totally new future. And this one line, taken right from the conference's own blueprint, really is the heart of the whole story. It's all about reframing a devastating situation not as the end, but as this incredibly rare chance for a complete reset. Okay, so to really get why this opportunity is so important, we have to understand the sheer scale of the challenge they're facing. We're talking about an education system that was already under a ton of pressure long before the recent crisis ever started. You see, the problems were baked into the system for a long, long time. Decades of centralization made everything rigid, kind of one size fits all. The curriculum had gone stale, meaning students were learning stuff that was pretty outdated. And the universities and hospitals, they weren't really working together. The recent crisis didn't cause these problems, it just blew them wide open for everyone to see. I mean, that's a huge question, right? When literally every piece of the system is stretched to its breaking point, from how students get in to how doctors get their specialized training, where on earth do you start? Well, it turns out the answer is you start by getting absolutely everyone in the same room. And that brings us to the response, a conference they've called New Beginnings. And this is not just another academic get-together. Nope, it's been designed from the ground up as a coordinated national effort to tackle all those deep-rooted challenges we just talked about. So AMES 2025 is actually the first ever national conference for medical education in Syria. And its real power? It's in who they're bringing to the table. We're talking everyone from high-level policymakers to first-year medical students, all in the same room with the same goal, to redesign the entire system together. And here's the really crucial part. The point of this whole thing isn't just to sit around and talk about what's broken. The entire event is built to be a platform for co-creation. It's about building real practical solutions that are tailor-made for the situation on the ground in Syria, not just copy-pasting a model from somewhere else. Now, to guide this massive undertaking, the whole conference is built around this really powerful framework they call the 10 Pillars of Reform. You can think of this as the master blueprint for changing every single part of the system. The first 5 pillars, they're all about shoring up the absolute foundations. Things like reforming admissions to make sure it's fair, that the best people get in, period. It's about supporting the teachers who've been working under just unbelievable conditions. And so importantly, there's a huge focus on the mental well-being of students and doctors, actually addressing the burnout and trauma that comes from working in that kind of environment. And the next 5 pillars are incredibly forward-thinking. Social accountability is basically about training doctors to serve the actual needs of their local communities. Technological adaptation is all about using smart, low-cost tech to fill in the gaps. And one of the most amazing parts to me is the plan to engage the Syrian diaspora, the thousands of skilled Syrian doctors and academics living abroad, to bring their expertise back to help rebuild. This right here, this highlights one of the biggest changes in the entire plan. This idea of community-responsive education, it's a major move away from the old model where all the training happened in big city hospitals. The new vision is to train professionals who can meet the health needs of the entire country, especially in those smaller towns and rural areas. Okay, so a 10-pillar framework. That sounds huge. Ambitious, right? So the big question is, how do you actually turn those giant ideas into a concrete plan in just 2 days? Well, the answer is in how they've structured the whole thing. They've split it up very logically. Day 1 is all about the foundation. That's undergraduate medical education. So fixing the core curriculum, admissions, all that stuff for every new student. Then day 2 builds right on top of that, focusing on postgraduate education, transforming the residency programs to create the kinds of specialists the country really, really needs. And the whole process is designed to go from just talking to actually doing. It kicks off with a clear diagnosis, everyone getting on the same page about the problems. Then it's straight into co-creation in these hands-on workshops. Strategy roundtables get the key decision makers to agree on the path forward. And it all wraps up with clear, specific calls to action. It's like a funnel designed to produce real results. So as we start to wrap this up, it's worth just zooming out for a second to ask, why does this one conference matter so much? What's the ultimate vision here? Because this initiative isn't just about writing new textbooks or building new labs. It's a very deliberate attempt to rebuild the entire culture of the medical system. The goal is to bake values like fairness, accountability, and a true commitment to the community right into the DNA of how Syria trains its healthcare heroes. And this, right here, is the end goal. This whole massive, complex, 2-day effort is all focused on this one powerful idea: to create a system that can produce, and this is so important, retain the skilled, compassionate, and resilient health workforce that the Syrian people so urgently need, and frankly, that they absolutely deserve. And that leaves us with this one final, really big question. Can a 2-day meeting of the minds really be the spark that ignites the renewal of an entire nation's health system? I mean, the ambition is just immense. But then again, as the blueprint itself says, amidst adversity lies opportunity.